Dialectical Behaviour Therapy. Maybe you're a mental health professional looking to use DBT, maybe you're a psychology student looking to add to your knowledge, or maybe you're just interested in what DBT can do for you. Well, if so, this is the course for you because you'll learn all about Dialectical Behaviour Therapy, which is an evidence-based psychotherapy that comes from cognitive behavioural therapy. It was originally designed to treat borderline personality disorder, but it's now used on a range of conditions including eating disorders, substance use, suicide, self-harm and depression. You'll learn all about the components in DBT, individual psychotherapy, skills training, telephone coaching and consultation teams, and you'll learn how it works and how to use it. We'll learn through looking at the theory, the practical and the skills that you need, and we'll use video, readings, quizzes, downloads and exercises so that whichever way you learn, there will be something in this course for you. Who is this course for? Well, it's for anyone that wants to learn dialectical behaviour therapy. So it's predominantly aimed at mental health professionals looking to learn DBT skills, but everyone is welcome in this course. I'll explain everything from the ground up, so you don't need any background experience in DBT. If you do have any previous experience in CBT, person-centered counselling or mindfulness, that's going to make it easier for you to understand the material, but it is not essential. Who isn't this course for? Well, there's a couple of notes. DBT is quite a big, challenging therapy. So if you're looking for a really easy form of therapy, DBT isn't necessarily that because there is a lot to learn. DBT is historically delivered in clinical team environments. Throughout the course, I'm going to talk about how it can be adapted to individual practice, but you should be aware that that is where it comes from, and also that it was designed to deal with personality disorders, reducing suicidal behaviour and self-harm. So there are occasional references to suicide, self-harm and abuse, and if those are sensitive topics for you, then just be aware undertaking the course that while they won't be discussed in graphic detail, we are obviously going to touch on them due to the nature of the material. I'm Chris, I'm a psychologist and member of the British Psychological Society. I've already taught tens of thousands of students online and I would love for you to be the next one. So if all of that sounds good, then hit the buy now button to get started. I can't wait to see you inside the course.